Hey, I'm Dr. John Minichetti. I am the current president of the American Board of Oral Implantology, and I'm very excited to be interviewing our current president of the American Academy of Implant Dentistry, Dr. Duke Heller, this evening. So a little bit about background for Dr. Heller. Dr. Alfred Duke Heller, he placed more than 20,000 implants in his career, and he was started in 1969. He earned his DDS from the University of Ohio College of Dentistry. And 10 years after school, he went back to dental school to get a specialty degree in endodontics, where he did research on dental implants and bone grafting back then. He completed a few FDA studies on implantology and bone grafting material. He's an honored fellow of the American Academy of Implant Dentistry. He served on the accrediting and credentialing committee for the AAID for over 10 years. He founded the Midwest Institute, which has been around since 1980, trained hundreds of dentists. Many of them are now credentialed members of our academy and board. And he is board certified, of course, with the Oral Implantology, American Board of Oral Implantology Implant Dentistry. He's the past president of the American Board of Oral Implantology, and he is now currently the president of the American Academy of Implant Dentistry. I can't say enough about all the encouragement he's given to so many, including myself, over the years. So, Duke, thank you so much for joining us this evening. How are you doing tonight?
I'm doing wonderful, John. It's so nice of you to have me on, and I so appreciate all that you do for implant dentistry. Thank you for doing that.
God bless you for that.
Thank
so we're
you.
going to just ask a few questions this evening because I wanted to pick your brain, you know, someone who's scholarly and an extensive background such as yourself in this field. I wanted to ask you some questions that I think our members would benefit from. So one of the first questions I'm going to give may be in your perspective, with your background, give us a little history about why the American Board of Implantology was organized by the American Academy of Implant Dentistry. And, you know, it says in the bylaws or the mission that they're there to elevate the standards and advance the science and credential. But really, what was the reasoning? Give me some history there. I think it's quite interesting.
Sure, John. The American Board of Oral Implantology was formed by several implant dentists who felt that the public could be best served by having expert criteria and examination of surgical skills to best serve the public. When the AAID helped charter the ABOI in 1969, it was felt by those dentists, most of them officers or past officers of the AAID, that if implant dentistry were to become recognized for the service of placing and restoring dental implants, a specialty of implant dentistry would be necessary, John. And so until there's a recognized specialty, the public cannot be best served.
Super, that's great. Yeah, I know the importance of those credentials. So some of my questions are going to gear towards that this evening. From your perspective as the president of the American Academy of Implant Dentistry, what do you think the benefits of having the AAID as a sponsoring organization for the American Board of Oral Implantology?
Good. Well, that's a good question. Probably a little lengthy answer, but the AAID and the ABOI are two parts of the journey of being an expert in implant dentistry. The AAID's mission, as you know, is to advance implant dentistry through education, research, credentialing. We support the profession by sponsoring that research, which innovates and improves implant dentistry. We share those innovations and improvements in our educational courses and publications like the Journal of Oral Implantology. We provide the education to become proficient in implant dentistry. As you know, the AAID credentials, which would be the associate fellow and the fellow, use the same psychometric testing, John, as the ABOI ID uses. And the ABOI uses psychometric testing to assure that credentials received are properly tested with consistent evaluations. We provide dentists a chance to go through the testing experience early in their career so that they will know the process and what to expect at the diplomate level, which you're now heading up that organization. Once you've earned the ABOI ID diplomate, the AAID keeps you current in implant dentistry and provides a forum in which they can share expertise with the next generation of implantologists. We're proud to be the sponsoring organization of the ABOI and provide support to become and to be a specialist in the near future in oral implantology.
I want to thank you for that answer. So, so my next question just kind of follows. So why would anyone want to become, or why should a dentist become ABOI certified?
That's a great question. Most people, men and women, who aspire to become better and possibly the best in their area of interest, usually take an initiative to excel. I think there are probably two reasons dentists want to aspire to attain credentials that represent the highest achievement in their field. The first reason, John, would be to help minimize complications with surgical procedures. As you know, those that are best trained have fewer complications than someone lacking those credentials. They have taken the time to learn the science and challenge themselves to prove their training and knowledge. Excuse me. I think the second reason is that the public deserves to have professional dentists excelling in the area of their treatment. Just as you and I would probably select an orthopedic surgeon to place an artificial knee if we needed the procedure, a general physician has the right to do a knee replacement, but we probably would want to go to a physician who has advanced training and knowledge in placing implants. So presently, the ABOI ID credential is the closest credential approaching specialization. The testing focuses all of the aspects of oral implantology. As you would know, oral surgery, perio, endo, prosthodontics. So it's just not one piece. The credentials of the ABOI is the closest to a specialty in implant dentistry that the public can avail themselves at this time.
So being involved with dental education for so many years, what advice can you give dentists or clinicians out there who want to become candidates, who want to educate themselves to become candidates of the American Board of Oral Implantology credentialing system?
Okay, well, the AAID offers maxi courses, which you've been a director for many years, but this is kind of an introductory into both surgical and prosthetic components of implant dentistry. Those who complete an AAID maxi course usually learn that they will need to learn more bone grafting techniques, perhaps better tissue management techniques, prosthetic techniques that are unique to implant occlusion. I also recommend reading the Journal of Oral Implantology and as well as attending the AAID annual conference. You'll learn the latest techniques and emergency technologies in implant dentistry through both of those. And at the conference, we get the added bonus of meeting other dentists with a passion for implant dentistry. Mentors like yourself play such an important role in education. I would suggest that those interested in learning, that they spend time learning from those who have achieved success in implant dentistry. I advise they visit those offices and spend a couple of days observing the doctor and their staff as they work together to serve their patients. Most men and women who have excelled in their profession are willing to share ideas, thoughts, and life experiences with those interested enough to ask. I know, John, you've opened up your office to many doctors and their staff that want to learn from you, but also learn from your staff. So that's how I would answer that.
That's true. Very, very important, the sharing concept. That's one of the true pleasures of our academy. It's always stood for that sharing of education and helping those to excel. And that's what it's about. And I know the academy is actually talking together with our ABOI to try to even develop further courses, curriculums. There's a lot of stuff in the works. So I think the future is bright for educating our members.
I so agree with you.
Super. So, a question on the AAID's mission to educate and credentials. What pathways do you see for the future with the AAID to help prepare these dentists?
Okay, I know the AAID is working on standardizing the Maxi courses so that all courses cover similar content that will prepare them to achieve success in implant dentistry. Dr. Bill Yang, who you work closely with, who is the AAID director for Maxi courses, has a group of faculty attempting to stabilize or standardize the teaching. This will lead to the AAID teaching advanced surgical and prosthetic courses, it will really encourage our members to attain not only the AAID fellow credential, but the epitome, of course, is the American Board of Oral Implantology, Implant Dentistry credential. It's the top. So a long-term goal, we're developing curriculum for master's programs in oral implantology. We hope to establish advanced education programs in implant dentistry at universities around the country. Hopefully, John, the year 2021 will be remembered as the starting of residency programs being instituted in 2 to 4 dental schools. And mark my word, John, implant dentistry will become a specialty in the near future, brother.
Awesome. So excited for it. I know it's a lifelong dream for many of us.
Yes.
So let's get into something personal. With all your accomplishments in implant dentistry, how has achieving the ABOI board credential positively affected you in your practice and your professional career?
Great question. I think patients look on the internet or used to in the telephone book to see those doctors who have credentials in the area they need treatment. I feel a better reason is that dentists who are just putting their toe in the water in implant dentistry need to have a referral source to serve patients who need help with complications or difficult diagnosis. I know you'd agree, John, that diagnosis is the backbone of success in any field. A credentialed implant dentist will have the skill to better diagnose treatment modalities with the most predictable results. We're all looking for predictability.
Yeah, very, very important. It's particularly in today's age of Facebook posts and everything now. It's so important for people to realize, and for particularly the younger ones to realize that you have that predictability in treatment for sure.
Yes.
Okay. So we're getting towards the end, but so I want to ask you a personal question. So, Dr. Hell, I know you're a devoted man of prayer and faith. I know you said many a prayer for me, whether it be in an elevator or before a board meeting. So thank you for that. It's helped. Can you share with us the prayers and hopes you have for our members and for the AID family?
Well, thanks, Dr. Minichetti, for asking me about the area of most important interest in my life, which is prayer. I so appreciate you also including the word family in your question. I've always felt that the responsibility of a mother and a father is their ability and determination to raise children with core values that will carry them through life. Dentists have a lot of stress, John, in their lives because I feel we must wear face masks due to our profession. You know, John, nobody wakes up in the morning and says, hot dog, I get to go to the dentist today. You and I and others in our profession, we must always appear to be in a good mood and to have our temperament under control. If I leave the house and run over the kid's cat, if my wife burns a toast, or if I have a flat tire before I come to the office, I got to tell a patient, you know what, my world's good. John, I've often felt that if prayer is part of my life, I'm able to call on my Creator to help me serve my patients, my staff, my individual family members, and also to serve the academy. I pray daily for the AAID items that come to me that need specific purpose direction. And John, I know you've been in the audience when I've had an opportunity to speak at the AAID annual meetings. I always start the lecture the same way. I'm in full-time ministry. I just do it as a dentist. John, I honestly and sincerely believe God called me to be a dentist. I also feel he's called me to serve the AAID for such a time as this. I'm blessed and truly honored to serve as president of the AAID. I do, however, feel that after God, the most important area of our life needs to be our families. My mentor, Zig Ziglar, used to tell me, John, he would say, Duke, spend time with the people who would be sitting in the front row of your funeral. My God, my family have always been my highest priority. If you and I put these first in our lives, there's plenty of time to become a very good implantologist. As an educator since 1980, I was privileged to serve men and women who had an interest in implant dentistry. But I always stressed to them, keep your priorities in order.
Well said. Well said.
Thank you.
Thank you. So, well, thank you so much for the interview this evening. I want to thank the president of the American Academy of Implant Dentistry, Dr. Alfred Duke Heller, for taking the time from his busy schedule to answer some questions that I thought would be appropriate, particularly for those of you considering the American Board of Implantology and for many of the members of our Academy, the AAID ABOI family. Any last thoughts you want to say, Dr. Heller?
Well, you know, I so appreciate having the opportunity to talk to you. And I've always respected you, John, because you, I think, have given as much to implant dentistry as anybody I've known over the years. And I practiced for 57 years. So I had an opportunity, obviously, to visit and to observe many, many dentists. And you have given so much, John. So I appreciate the just the interview. I truly am honored to be serving the academy, and just the fact that we probably will at least get the ball so close to rolling in 2021 with this specialization that I'm just honored to be part of that.
Well, thank you. Thank you so much for the kind words. And thanks again for taking the time this evening.